This segment is sponsored by GBMC Healthcare.
Bariatric surgery has shown to be a successful way for people to lose unhealthy weight, and now new studies are showing it may be beneficial in other ways as well. Joining us now is bariatric surgeon for GBMC's Comprehensive Obesity Management Program, Emily J. Waters. Emily, welcome. How are you?
Hi, thank you. I'm good. How are you?
Great. So what types of bariatric surgery are available, and how would you recommend that people decide which ones to get?
Yeah, so we have two different options, the sleeve gastrectomy and the gastric bypass. They're both done minimally invasive. They have a lot of similarities, but the main difference, I would say, is the bypass is better for patients with diabetes and with acid reflux. So it really depends on the patient and what their other medical comorbidities are.
You know, Emily, I had the sleeve, and I have to say, I really am glad that I did it. So talk to us about talk to us about how weight loss surgery affects your overall health.
Yeah, so for a long time, bariatric surgeons, we've known that that obesity affects cancers, high blood pressure, diabetes, all these other medical conditions. But just recently, there's been two studies that have published that have shown a direct correlation with having bariatric surgery and reducing the risk of cancer.
Wow, can you fill that out for us? Talk more about that. That's interesting.
Yes, so the Cleveland Clinic just published a study that showed 30,000 patients over 13 years. They compared obese patients who underwent bariatric surgery and those who didn't. And the patients who underwent bariatric surgery, they had a 32% reduction in their risk of cancer. That's huge. And also a 48% decrease or reduction in death from cancer. So those are huge numbers that are very important. And the other studies showed that patients who didn't undergo bariatric surgery and who are obese, they had a 2 times risk of cancer. So now that we're seeing studies actually prove what we've known for a long time, it's very exciting that we have these facts to help counsel patients about bariatric surgery.
Wow. So what are the criteria for going ahead with weight loss surgery?
So the BMI, your BMI has to be over 40 or over 35 in a medical condition like high blood pressure, diabetes, sleep apnea. You can calculate your BMI by going online, type in BMI calculator. It's a combination of your height and weight.
Talk to us about how weight loss surgery helps you lose weight.
Yes, so it's very interesting. So when it first started out, we thought, oh, the sleeve, we reduce the size of your stomach or reduce that. And that's part of how you lose the weight. But there's also a lot of changes in how your gut signals to each other, your brain, all this changes in your insulin levels. So it's very complicated how it works, but it's very exciting.
Emily, thank you so much for joining us. This is great information. And like you said, I actually had the surgery about a year ago. I've lost over 100 pounds, and so I definitely do believe in it.
Oh, that's awesome. That's great.
Where can people go to get more information?
So they can go to gbmc.org/weight loss.
Thanks so much, Emily, for joining us, okay?
Okay, thank you.